afternoon, everyone. I'm introducing my PhD topic, which is pathophysiology, diagnostics, and prognostics of acute illnesses. I'm Gabriella Rapszky, working at the emergency department of Semmelweis University. My supervisor is Bank Fenyves, and my scientific methodology supervisor is Fanny Adél-Meznerics. Our statistician is Tamás Kói. My vision is to improve the management of patients with acute illnesses presenting in the emergency department, and my mission is to contribute to the already existing guidelines. I have two ongoing projects right now. The first one is a diagnostic accuracy meta-analysis, which investigates the diagnostic accuracy of rapid molecular assays in bloodstream infections. And the second one, it will be a retrospective study investigating ClotPro, which is a viscoelastic method-guided therapy in patients with gastrointestinal bleeding. So this is my first project. It's investigating the efficacy of rapid molecular assays in the diagnosis of bloodstream infections. The method we are using here is a meta-analysis. So a little bit about the background. Sepsis is life-threatening organ dysfunction caused by a dysregulated host response to infection. And it can be diagnosed when there is an evidence of severe inflammation and documented or present bloodstream infection. There are 49 million cases of sepsis around the world, causing 11 million deaths each year. So the management of this condition is important because early management with adequate antimicrobials and rapid resuscitation strategies has been associated with improved outcomes. The gold standard diagnostic method for this bloodstream infection is the blood culture right now, but unfortunately these have a long turnaround times. And to resolve this problem, there are already existing rapid molecular assays which can allow earlier pathogen detection and identification. These tests can be classified as tests performed on a positive blood culture sample and tests performed on a whole blood sample. And the latter does not require a positive signal from the blood culture, so even shorter turnaround time can be achieved. So here our aim is to investigate the diagnostic accuracy of these molecular assays which can be performed on whole blood samples. So our clinical question was, what is the diagnostic accuracy of these rapid molecular assays for bloodstream infection? And for the PICO, it's a little bit, for the index test, it includes all the rapid molecular assays performed directly on whole blood. And the reference test is the gold standard blood culture. And our hypothesis is that the diagnostic accuracy of these rapid molecular assays is non-inferior to conventional blood cultures. And so our clinical implication is to provide a faster diagnosis for patients with bloodstream infections. We conducted a systematic search in 4 databases on the 10th of January, and here you can see the search key below. It consists of 5 domains, basically consists the synonyms of the PICO formulas. And the systematic search resulted in a pretty large number of articles. And right now we finished the title and abstract selection, but the second revision is ongoing right now. But we already have, because we are in the data full text selection and data extraction process, we have some preliminary results of 15 articles, and we focused mainly on one device, which is called SeptiFest. And it can, the SeptiFest is a PCR-based device which can identify 25 pathogens directly from blood samples. And here is a two-dimensional rock plot analysis showing the sensitivity and specificity of the test based on these 15 studies. And each cycle as a rock plot, a little bit, if you haven't seen it, on the rock plot, the cycles representing each study, and the blue square is the pooled sensitivity and specificity, which on the figure it shows, which we extracted on the right, the sensitivity is 0.67 and the specificity is 0.82. So what else we can see on this plot? That the smaller ellipsoid is the 95% confidence region, and the larger ellipsoid is the 95% predictive region, which meaning that if a new study was conducted, its diagnostic measures would mainly fall into the region of the prediction, the predictive region. And these data can also be shown on a one-dimensional forest plot analysis. We extracted data for the true positive, false negatives columns, true negatives and false negatives. So all the as the contingency table. And what we can see, which we also can see on the slide before, that the heterogeneity is quite large for the studies. And so this is our first project right now. The second revision is in progress for the title abstract selection, and we are proceeding with the full text selection and data extraction in parallel. So as for my second project is investigating the association of clotpro-guided therapy with blood products used in mortality in patients with gastrointestinal bleeding. Clotpro is a viscoelectric method that can provide a rapid assessment of coagulation. It will be a retrospective study, and the database we would use is our own from the emergency department, extracted from MedSol. So gastrointestinal bleeding is associated with high mortality and morbidity, and its incidence is 33 to 47 per 100,000 population. Viscoelectric methods such as this clotpro device provide a rapid assessment of coagulation and facilitate a more accurate targeting of therapy compared to the conventional laboratory test alone. There are already existing guidelines recommending the utilization of these viscoelectric methods in trauma patients as well as in patients with perioperative bleeding. But there is no strong evidence of the benefit of using viscoelectric methods in massive gastrointestinal bleedings. So the benefit from the trauma care research might be extrapolated actually in our case. So here is our aim, so to observe the differences in the management and outcome of patient receiving this clotpro-guided therapy. Our clinical question is, what does the use of clotpro influence the management of GI bleeding in the ER? And here you can also see the PICO, for patients with gastrointestinal bleeding. In the intervention group would be patients where clotpro was performed. The comparator group would consist of patients where clotpro would not be used. And we would use separate outcomes, a primary outcome, which would be composite outcomes, including, for example, further bleeding leading to red blood cell transfusion and 30-day mortality associated with the GI bleeding. And as for the secondary outcome, a total blood product use would be examined. So here are hypotheses referring to the outcomes, that the use of clotpro improves the clinical outcome. This is the first hypothesis, and the second one, that the use of clotpro optimizes the number of blood products transfused. Yes, also the clinical implication is to optimize the allocation of blood products. And here is a summary of my presentation. So for the first project, we are in the phase of the full text selection and data extraction phase. And for the second one, we are at the very beginning. Thank you for your attention.
Thank you for the presentation. I would like to ask something about your results. So if I understand correctly, that the gold standard sort of traditional blood culture method is slow, it's more accurate, and this septifast is faster, obviously, but the sensitivity and specificity in general is lower. So would you actually choose this rapid method compared to a blood culture in your own practice?
Well, I think I wouldn't, and even it's a test because there are several commercially available tests. This test actually has been off the market since a few years because it's low sensitivity, but we decided on including this one also in the meta-analysis. But there are also several other commercially available ones, maybe with higher sensitivity. So actually, the marketing of this device has been stopped for years.
Thank you.
Thank you for your question.
I also have a question. My question is regarding your second topic. I was just curious how exactly the treatment of the GI bleeding is adjusted according to the results of the ClotPro test.
Mm-hmm. So it's a little bit subjective because the clinician decides on the therapy based on the result of the ClotPro test. So yes, that's under discussion thing whether to ask every clinician what they used, or maybe it's written in the database. It's under discussion, but thank you for your question. It's a really good question, actually.
Thank you for your presentation. I have a question for your second topic. How often this kind of gastrointestinal bleeding occurs in the emergency unit? So in a mouse, how many patients you have with this kind of symptoms?
Yes, that's a very good question. I need to check that actually because I only spend altogether we have around 6,000 patients since 2018, but in the first 2 years this ClotPro device was not used as frequently as it is now in the past 1 or 2 years. So it's a little bit of bias because among these 600 patients there could have been more in 2018 and 2019. We just didn't use this device. It didn't use it. So okay. I have to check.
Okay, thank you for your answer.
The SeptiFast is a 16S PCR based test, right? So it's amplifying the 16S subunit of the mRNA. How can it be that it's still the sensitivity is 0.6 when it's just amplifying all bacterial DNA from a sample which is standardizedly drawn? I mean, it's blood, it's not like sputum or something.
That's actually, thank you for your question. It's maybe actually a limitation because it also amplifies the contaminants. So it's always, there is another factor when true negativity, true positivity is estimated, and maybe the clinician, based on the result, decided on this result as a contaminant. And that's why SeptiFast always amplifies also the contaminant samples as well.
Contaminant like other bacteria contamination?
Like, for example, Staphylococcus epidermidis is sometimes considered a contaminant, and it's never...
Yeah, but it's much more the case in the case of hemocultures. So it's much worse in the gold standard than in this.
Yes, it's actually, we are actually planning to run another statistical analysis whether blood culture is truly the gold standard. So whether SeptiFast is or other devices can be more of a gold standard type test.
Thank you.